on Let's Talk FGM, we're focusing on maternal health and female genital mutilation. That's the focus of conversation today, maternal health and female genital mutilation. Let's Talk FGM is an initiative of Haiti Health Initiative in partnership with the United Nations Trust Fund. So today we are talking about maternal health and FGM, that's female genital mutilation. Female genital mutilation is the act of cutting or mutilating parts of the female genitals. It is an extremely harmful practice, and therefore there is no known benefit to it. An estimated 200 million girls and women alive today between the ages of 15 to 59 are believed to have been genitally mutilated at one point or the other. There are stories of those who have suffered great difficulty during and after childbirth, and that is the focus of conversation today, maternal health and FGM, that's female genital mutilation. The number to call to contribute is 07000 917 917, 07000 917 917. You can also call in. You can also send a text message or a WhatsApp message to 0703 175 6537. 0703 175 6537. Let's Talk FGM is an initiative of Haiti Health Initiative in partnership with Women Radio 91.7 and funded by the United Nations Trust Fund to end violence against women. Today on Let's Talk FGM, my guest is Dr. Odofin James Taye, consultant obstetrician and gynecologist, Federal Medical Call Center, Ibutemeta. Good afternoon. Thank you very much for joining us on Let's Talk FGM.
Good afternoon, my listeners, and I'm happy to be here to have the discussion on maternal health and FGM.
Yes, thank you very much. Once again, the phone lines are open, 07000 917 917. That's the number to call, 07000 917 917. You can also send a text or a WhatsApp message to 0703 175 6537. In line with conversation on female genital mutilation, I earlier defined it as the act of cutting or mutilating parts of the female genitals. We've been having this conversation over time, and FGM is the only thing that is constant throughout this conversation. I mean, the program itself is called Let's Talk FGM. So today that we're focusing on maternal health and female genital mutilation, what are some challenges that women face during childbirth due to female genital mutilation?
Well, thank you so much. For us to have better understanding of the challenges that women face during childbirth with respect to female genital mutilation or cutting, we have to have better understanding of what is maternal health. And anytime we are talking about maternal, we are talking about something that's related to pregnancy, yes, related to childbirth and period of 6 weeks following that delivery. Therefore, it is believed that maternal health should give someone or a woman a sense of positive fulfillment following delivery. But it's unfortunate there are some challenges, both physical, mental, and social, that have negative bearing on this positive fulfillment that a woman should naturally have following childbirth.
Okay.
And this is not unconnected with the sequelae or with the antecedent history of female genital mutilation in them. And I tell you, I'm talking about pregnancy related. There are issues that even occur right even before the pregnancy that will make this conception, sexual intercourse that will lead to conception,
okay, to
look somehow as if, in fact, it looks as if it's better for a camel to pass through the needle's eye, as it's usually said in that idiomatic expression.
Mm-hmm.
making sexual intercourse to be difficult, if not almost impossible. And this then make a woman to fear childbirth. In fact, if she could survive the ordeal, the agony, the pain, or even the bleeding following whatever intervention that is done by the husband, because in some cases, depending on the type of the female genital mutilation, if it's like type 3, in which they have to suture sew the vaginal outlet
Leaving only the room for
and leave only the room. So you can imagine if the husband wants to,
urination and menstruation.
yes, if the husband wants to have sexual intercourse, of course I've paid your bride price. I have to consummate this marriage, and I have to have sex with you, and it's not entering. So what will I do? Some go as far as using razor blade to cut it, to widen it, and that's the beginning of the agony.
Yes,
That's the beginning of nightmare, which will have negative impact on the outcome of that pregnancy. So if finally she gets pregnant, apart from the fact that there might be an infection, blood-borne infection, right from the time it was done,
okay,
the woman might even be HIV positive or hepatitis B positive, which as a result of the previous FGM she has had. So this will also have negative bearing on the outcome of that pregnancy. So what they face is not only from that pregnancy or the outcome, right from when it has occurred.
Let me stop you
Yes.
there for just 1 second, because now I think there's a lot more that comes even before the challenges
Yes.
during childbirth,
Yes.
which is what you're trying to give us a
Yes.
background on,
Yes.
so that we don't rush through it and get
Yes.
to the challenges during childbirth. I'd like for us to take it one after the other. So you've rightly mentioned we don't know if she could be HIV positive or hepatitis B positive.
Yes.
How is that going to be in the first place?
You see, when from I do not have the luxury of, or let me just paint the scenario of how this female genital mutilation is being perpetrated by the women folk, the elder women folk to the young girls. They just take them to a place where there's somebody they call circumciser, the traditional circumciser, with unsterilized instruments, which study has shown that they can use for like 20 to 30 people on a day. The same instruments. Not like the single used and sterilized blade. So they make use of this razor blade. In fact, some use what we call thorns of certain flowers, acacia thorns. They can make use of leaf, just to make that cut. The cut can be made using anything that is not sterilized. Now, from one girl to another, like 20 to 30 of them using the same razor blade. Probably they just dip inside something and use it. So there is transmission of possible HIV or hepatitis during the procedure. That has been there. So that means before we can even talk about maternal health, what is the child's health? That means this child's health has been compromised from childhood. When you look at the definition of health, it is complete physical, mental, and social well-being of an individual, and not merely absence of disease or infirmities. That means right from childhood, this child has been impaired physically, mentally, and socially, health-wise.
Even before she grows into woman.
Now, when she grows into humanhood, attainment of menstruation now comes with another challenge: painful menstruation. In fact, the menstruation might not even be seen. We call it hidden cryptomenorrhea. The woman is menstruating, the young lady is menstruating, but it's not coming out because of the kind of suture they've used. So it's trapped behind. So every month there's this cramp, periodic cramp, yet there will not be anything coming out. So there is blood inside the vagina or blood inside the uterus. Apart from the fact that this woman might have had pelvic inflammatory disease as a result of this unsterilized procedure that was perpetrated on her. So you discover that even getting pregnant to maternal health is even challenging. There will be infertility, there will be pelvic inflammatory disease, there will be chronic pelvic pain, there will be everything associated with poor gynecological outcome. So now let's even imagine that the woman survived. I'm only talking about people that even survived that excess blood loss during that procedure. Many young girls died, during that procedure. Some have a kidney injury. Some have a lot of complications following it. Now let's talk about the people that now survive to manage to get pregnant. That's where this topic now seems to start from. But I just have to start to establish that. Before this,
I'm grateful that you did. Yes, I'm grateful that I just have a question.
Yes.
In line with menstruation that does not come out,
yes.
that hidden menstruation,
yes.
that there's a lot of blood, does that cause any health challenge?
Yes, thank you so much. You see, there's what we call endometriosis. Endometriosis is the presence of the inside of the womb, that particular carpet, let me use that word,
okay,
that secretes the menstruation. The particle can find themselves outside the womb. Therefore, they begin to behave as if they're inside the womb, causing some form of inflammatory problem in the pelvis, causing chronic pelvic pain. The woman just be having pain. In fact, it can also cause ovarian cyst. Now, one of the theory of this endometriosis is when there's backflow of menstruation. What do I mean by backflow? Instead of coming out,
yes.
for whatever reason, something blocked the exit, and there's damage back of the menstruum coming out from the tubes into the pelvis, lower abdomen. So that is one of the theory. So a woman who is not seeing a period might have endometriosis as a result of the
along with chronic pelvic pain, like you mentioned.
Apart from that one, there may be infection. There may be infection, as I've said, which may also compromise the ability of even getting pregnant in the first place. Of course, if any woman is having that one, go to your hospital and see a gynecologist. There's a way out. Probably to just do some little expansion of that opening, so that menstruation will be coming out. So it's not something that they need to take the person back to where it was done and say, okay, Baba, come and help us do something. What you did the last time, it's like the period. It's not coming because, as you rightly said, it's not only children that this evil is being perpetrated upon. That even some young girl, they also experience this. So it's just a matter of coming to see a gynecologist, and something will be done to increase the opening or the outlet, so that more menstruation will come out at every month.
Thank you very much, Dr. Odofin. This is still female genital mutilation. In a moment, we're going back to the original question. Yes. I just really needed us to establish that background, because he kept making mention of all these different things. And in my mind, I'm like, okay, we haven't even talked about these things. And these are so important that we establish this background before we now get to the subject of maternal health and how female genital mutilation applies to maternal health. So thank you again for that.
Welcome.
This is still Women Radio 91.7, and you're still tuned to Let's Talk FGM on Women Radio 91.7. Let's Talk FGM is an initiative of Hasty Health Initiative in partnership with Women Radio 91.7 and funded by the United Nations Trust Fund to End Violence Against Women. My name is Somto Titilayo Ajama, and today we're still talking about maternal health and female genital mutilation. Maternal health and female genital mutilation.
My mama tell me say she won't carry me go buy biscuits. But say she carry me go our old mama house. The way she mama cut me, child. I still imagine the pain as it weak me for body. My mama said that to make sure say I know the follow boys anyhow. I wonder how it take it to waka with boys matter. I wonder. Circumcision don't cost me plenty health palava. And I don't go even wish my enemy picky to suffer with her don't suffer. Child.
My country people, circumcision no good at all. You know, if stop girl to the follow man there. You know, if it help woman to find picking born. In short, inside over 20 million Nigerian girls and women with suffer circumcision, or many of them they also suffer health palava, plus including pain when they want menstruate, born, or even when time reach to enjoy themselves with their man for other room, whether in a local place or for inside hospital. Circumcision be very bad and dangerous. You don't get anything good way they do for body. Make we join us. Stop circumcision today. Now this health initiative through Stop Cut project will be funded by United Nations Trust Fund to end violence against women. Bring una this message.
Check us out on Facebook, Twitter, and Instagram. WFM 917.
Still, let's talk FGM on Women Radio 91.7. My name is Sumto Titilayo Ajama. Let's Talk FGM is an initiative of Haiti Health Initiative in partnership with Women Radio 91.7 and funded by the United Nations Trust Fund to End Violence Against Women. Today on Let's Talk FGM, our focus is maternal health and FGM. Maternal health and FGM. I have with me our guest, Dr. Odofin James Taye, and we are talking consultant obstetrician and gynecologist, Federal Medical Center, Ebute Metta. Thank you again for joining us today, Dr.
Thank you for having me.
You're very welcome. 07000-917-917 is the number to call. 07000-917-917 is the number to call if you have any questions or any reactions, anything you want to contribute on the program. You can also send in your text or WhatsApp messages to 0703 175 6537. 0703 175 6537. We're streaming live on Facebook and YouTube, at WFM 917. That's the handle, at WFM 917. You can follow us and watch the program live as we go on. You can also listen live via the website, www.wfm917.com, or download the Women Radio app on Google Play Store and listen live as well. Once again, 07000-917-917 is the number to call. Text or WhatsApp messages go to 0703 175 6537. Going back to you now, Dr. Odofin.
Thank you.
I asked earlier, what are some of those challenges that women face during childbirth due to female genital mutilation? Now, in the process of answering that was when you established what maternal is and all those other challenges that happen even before it gets to that point of pregnancy. So let's go on from that point.
Thank you so much. When you talk about maternal health, some include preconception before pregnancy, because it takes someone which have a successful preconception to have successful childbirth. So now let's start with the challenges during pregnancy. As I've said, the woman might dread coming to the hospital to come and give birth in the first place. As I've told you, initially to even have that pregnancy in the first place was challenging, traumatic. Managed to get that pregnancy because they detest anybody trying to even examine them vaginally. And there's no how you will come to the hospital, for labor or for delivery, that your vagina will not be examined. So there's number one, there's difficulty even in doing vaginal examination for them because the capacity, the distensibility, the elasticity of the vaginal wall has been compromised, has become rigid. So examining them might be painful, might be difficult, just the same way they have painful, not fulfilling sexual intercourse before. So one of the things that there's difficulty in doing certain things for them. For example, if you want to do induction of labor for them, there are things we need to do. It will be very challenging, it will be very difficult. Apart from the fact that if you want to do some monitoring of the baby in some climb, monitor the fetal rate of the baby using some devices through the vagina, it might be very difficult. Now, if they finally fall into labor, the labor might be prolonged. Lead into what we call obstructed labor. Why obstructed labor? The distensibility, or depending on the type of scar that is formed. Scar will not allow the capacity to distend, the vaginal capacity to distend. The scar is very rigid. Okay. So there is likely to be obstructed labor, and when there's obstructed labor, depending on why this woman presents, it might end up having obstructed labor with a sequelae. What are the sequelae? The baby might even die. The baby might not come out in time. When we say obstructed labor, it means the labor is no longer progressing in respect to what you have done unless there's surgical intervention. You understand? So now imagine someone in traditional birth attendants at home trying to deliver, and the sequelae or the complication of FGM has now made vagina not to distend to allow the baby to come out, you can have obstructed labor with what we call vesicovaginal fistula, following it. Or the baby might die, there may be uterine rupture. So from obstructed labor alone, you can have some obstetric catastrophe, from this one. Again, there's what we call primary postpartum hemorrhage. That is bleeding following delivery as a result, and this one is as a result of the tear of the vagina wall. The reason is just in the process of childbirth. When the baby finally comes out, because of the scar, the vagina can just tear ragged. I mean, in a multi-dimension, not like the one that you just give a cut. Even if you give a cut that is called episiotomy, in fact, they will need it. When you give the cord, despite the cord that you are giving, it might still distend. It might still extend beyond your cord. It can even extend into the rectum where the feces comes out from, and that's like 4th-degree laceration of the perineum. Now, this is another problem as a result of what was done during childhood. Now there might be need for the delivery to be by cesarean section. That's an added
to prevent the tear, or after the tear might have happened.
Now, to prevent, because of the treatment for obstructed labor that was recognized earlier.
Okay.
I said if the person was in a traditional birth attendant that didn't know what to do, that they need to do surgical intervention, they will just keep pushing, doing a lot of things until baby might die. And the person might end up in a tertiary hospital where they will still do cesarean section to bring out a dead baby. So it's just unfortunate. So there may even be the sequel of that, which I call vesicovaginal fistula. Now back to cesarean section. Vaginal section just as a result of, because that place you try to prevent obstructed labor, you do cesarean section, which is complication possibly. Other things are just excessive bleeding from that cut, or from the tear, tear of the vagina because of the rigidity, because of fibrosis that has occurred following the FGM that was perpetrated on her. So, and when this occurs, the patient might even die, depending on where the labor is being conducted, or depending on whether blood is given in time or not. So we can also have that particular one. Apart from all this one, it's been said that babies that are born from all these challenges of childbirth might end up, having some form of what we call birth asphyxia. Asphyxia is just like suffocating, the baby in a way. The baby might end up in neonatal intensive care unit. The baby might even die. You understand, because of all this rigor of trying to maneuver its way outside. Now, even if this baby is now born, one thing we should recognize, we should know as regards women who have done female genital mutilation they have this psychosocial issue also. They are just not happy.
Yes, we mentioned some of that when we talked about psychological effects.
They're not just happy about what has been done to them, because they felt some sense of humiliation, especially I won't do, you will do, I won't do, you will do. For some of them that want to object it at a time. They also feel like they feel betrayed by the people they love, their parents. Something like, my mom, like that advice that you throw. My mom took me to a place, and some might even say my daddy just threw his face away when I came back crying. Drinking his palm wine, did not bother about what happened to me. That means my daddy is also connivance to this that happened to me. So they are not happy. And one of the things that cause what we call post-delivery blues, which just like little transient psychological problem following birth, or postpartum or post-delivery depression or psychosis on the extreme. They may want to even kill the baby or kill themselves. Is what has happened before. The psychology of the person before that birth. Some are not just, now after delivery, they're not just happy about the whole thing. A positive experience, they are sad, they are not happy, because they're having flashback, they're having ugly nightmares as regards particular place. The painful procedure that they underwent, it's like they are doing the same thing to them, but this one is done medically by reason of maybe cutting them open to allow them to have successful vagina, or what we call infibulation, when they try to medically try to cut it open. They still see it as if something being perpetrated in my private part. So they are not really happy, and this might have negative bearing even after the baby is born. The way they see that baby, the way they see their life, the way they even see their husband, they are just annoyed about the whole thing around them. So these are just few of the challenges, as I've said, by reason of the during childbirth, you have problem of you have to give them episiotomy, to expand the vagina, and this episiotomy might even extend beyond what you even cut. Even if you do not give it, I can tear in a multi-directional ways, in which it can even extend to the rectum. You can imagine from vagina to rectum, and before you know it, there may even be a problem as a result of obstructed labor, in which there will be vesical vaginal fistula, that is abnormal connection between two epithelial surface. For example, now between bladder and vagina. God has done in such a way that bladder is up, vagina is down, depending on how the woman is lying. And if there's not a connection, it's just like the roof of the vagina leaking urine, or from the back of the vagina, feces start coming into the vagina. It can be so distressing, to the woman, and as a result of obstruction labor, which occur because of an FGM. So this FGM is what should be eliminated in totality. In fact, it should be trashed to the dustbin of history, where you just say, okay, there was a time this was being done, but now it's no longer being done. But unfortunately, I tell you, it is being perpetrated maybe in a discreet way, right? In this modern time, to the extent that some people are even talking about medicalization of it.
Exactly.
Let us do in such a way that
I was coming to that.
Yes.
I was coming to that.
That is just what I have to say as regards some of these challenges for now. It has physical, physical abnormality that occur during that delivery. Even psychologically, they are also affected. It affects their mood. There's mood swing, there's ugly flashback, there's nightmare, there's feeling irritated, panic attack, and all these are not too good for a nursing mother. A nursing mother who should be happy, but because of what has happened in the past, and because of what he has passed through during that delivery, what was done to her, even medically, they felt bad, and that is even for those that allow you to examine them, because some are so frightened that they don't want anything to come near them by reason of vaginal examination to assess the progress of labor.
There's a lot that you've said. There's a whole lot that you said that now makes maternal health sound very small.
It's small
compared to every single thing that you've laid down on the table today.
Yeah.
And we're coming back to that. The aspect of medicalization is another thing I want you to discuss.
Okay.
And we'll get to that in a second. This is still Women Radio 91.7, and you're still listening to Let's Talk FGM, when we discuss everything relating to female genital mutilation. This is still Women Radio 91.7.
Keep it loud. Turn your radios up. Wow.
WSN 91.7.
We go live.
Mama Dora, bring Dora, come on. Mama Dada, don't come circumcise her.
You want circumcise your pikin? This generation where everybody don't know say circumcision no good at all. Now you want destroy your pikin life. Papa Dora, you don't know say person wey pay somebody to do circumcision, and person wey do the circumcision, now all of them go prison wey fit reach like 4 years, and dem fit still even pay 200,000. If you give person ordinary advice say make dem do circumcision, you go fit go prison for like 2 years and still pay like 100,000 fine money. In short, when my phone make I call this law enforcement agency to go arrest you, wetin dey do no good.
You no circumcise Dora again, eh? Papa Dada, carry your yama knife comot my house. Only self go report you.
Circumcision no good at all o, as e dey cause plenty health palava for girls body. My people, if you hear or see person wey wan circumcise any girl, sharply go to law enforcement person near you, or make you call 0812 467 0069. Female circumcision no good, make we join hands stop am.
Na AC Health Initiative through im Stop Cut project wey dey funded by United Nations Trust Fund to End Violence Against Women bring una this message.
She loves music. Let's go. Please over here.
kiss. Vegas 91.7 Women Radio.
Still, let's talk FGM on Women Radio 91.7, where we discuss everything relating to female genital mutilation. Let's Talk FGM is an initiative of Hasty Health Initiative in partnership with Women Radio 91.7 and funded by the United Nations Trust Fund to End Violence Against Women. My name is Sumto Titilayo Ajama, and if you're just tuning in, today we're discussing maternal health and female genital mutilation. Maternal health and female genital mutilation. I have my guest with us, Dr. Odofin James Taye, consultant obstetrician and gynecologist, Federal Medical Center, Ebuti Menta. To join the conversation, you can call in to 07000 917 917, 07000 917 917. You can also send in a text or a WhatsApp message to 0703 175 6537, 0703 175 6537. We would definitely love to hear from you. We're still talking about maternal health and female genital mutilation, and Dr. Odofin has basically told us the risks or the challenges that women face during childbirth due to female genital mutilation. Before that, he talked about all the resultant health effects that have happened from childbirth when the child was mutilated up until pregnancy. And now we're talking about challenges. We've talked about challenges, and we're going into medicalization and what that has to do with maternal health and female genital mutilation. Again, the number to call is 07000 917 917. You can also send in your text and WhatsApp messages to 0703 175 6537. You mentioned medicalization as something that people do now, as opposed to the traditional circumcises. And in relation to maternal health now, particularly before everything that happens before pregnancy, does medicalization ease or change the adverse effects of female genital mutilation when it comes to medicine, the health effects?
Okay, thank you so much. You see, it's not as if medicalization of FGM is what is done now.
Yes, of course.
Yeah, it's a kind of social acceptance package that people who are bent, on doing female genital mutilation or cutting are advocating for, so that it will give it a kind of medical coloration or a kind of backing or acceptance. That's just it. Oh, they are saying, okay, if you people say we should not do this tradition, which is our culture, of course, when you ask them to break it down, what has all those reasons they put forward, what has female genital mutilation got to do with increasing bride price, making someone not to be promiscuous, making someone to be morally upright or sexually upright, what has that got to do with inclusion to the social class or inclusion to the society? What has that one got to do? You are just mutilating someone and someone's anatomy, and been described as a grave torture, or gender-based torture, against women. Now
it's also a crime.
It's a crime,
and it's a violation of human rights as well.
Now you now say medicalization. It's just like, okay, if you are complaining that we are using unsterilized instruments and that causes HIV or hepatitis. Okay, let us come and do it in an hospital. Let a doctor do it. You understand? So that it will be synonymous, like the male circumcision that is done. If a male should do, let our female girls do. They are just saying it to make sure that it has a backing. But World Health Organization has come out with a clear declaration that no doctor, no medical personnel should participate in it. And the reason is very simple. When you begin to do it, this program you are doing, that means it's not going to have any positive effect, in the sense that just as you are trying to eliminate it, it's like it's being through the back door. Other people have been doing it medically, legally, and this is what World Health Organization is saying it is not acceptable. So irrespective of whether it is done in the hospital by medical personnel, it is still barbaric. It is still something that should not be done. It's something that is still cruel, because you distort someone's anatomy, making the person not to enjoy whatever thing she has to enjoy sexually, So whether it is done medically or traditionally, it is still very cruel, and it should be eliminated and should be stopped.
Thank you very much. What I'm getting from what you just said now is there's really no health benefits when it's done medically.
Yes.
There's the way there's no health benefits when it's done traditionally is the same exact way that there's no health benefits when it's done medically.
And the medicalization is not only pertinent to maternal health. You understand? It's pertinent to female genital mutilation globally in every aspect. That's why even in developed world, people that migrate to developed world, they want to have it done under a controlled environment. No, it is still not acceptable.
Absolutely. Absolutely. So are there any long-term health complications for the mother after childbirth as a result of FGM?
Yeah, you see, even if there's what we call the infibulation. As I've said, the long-term effect that the woman will have is just more of psychology. You understand? It's not as if it cannot be treated. I'm talking about the infibulation. It can be de-infibulate by opening it. Of course, the woman will begin to have good sexual experience. But in the long run, flashback of that painful procedure that was forcefully done on her will go a long way to be giving her some psychological problem. So it's not, apart from those who are unable to even get pregnant because of infertility that set in following pelvic inflammatory disease, following inability to have sexual intercourse unless treatment is done to them. So the long-term effects are what is likely to be like blood-borne infection, like HIV, that have been contracted during childhood. Of course, the woman will be remembering this for the rest of her life, like hepatitis that was contracted during the time it was done, and also for infection, pelvic inflammatory disease that has occurred and is sequelae. And what is the sequelae of pelvic inflammatory disease? You have chronic pelvic pain. The woman will just be having low abdominal pain, waist pain that is not even related to menses. Patient will also have infertility. There will be problem with the tubes. So ability to get pregnant is zero. And this will have impair on the marital and stability of that home. There's marital disharmony because the man will say, "See, you are the one that have problem." In fact, the man may not even relate it to FGM, just relate it to the fact that you are not pregnant. Whereas this problem has started from childhood or from young age. The woman has 13 when this was done. So the sequelae are just the negative impacts that FGM will have on the mother. On the mother. So they are. You can only just imagine them than experience. So it goes beyond the physical, but the psychology is the one that even that's very paramount, because your psychology determines everything. The woman sees herself as being inadequate. When they are within the community where this is done, they feel that they are normal.
Yes,
okay, it's normal. It's done to all of us. But by the time they get to another society, migration, and see that my own genital is different, that's when they begin to have some form of psychological problem as regards this one, and they can even lead to suicidal tendency. And that is one of the long-term sequelae of FGM in mothers.
That doesn't sound like something any woman should be going through.
No.
That doesn't sound like anything any woman should be going through, particularly as a result of something that could have been done without. Something that they could have completely skipped because there's still no benefit.
Yes, when they want to talk about the treatment, the first thing they usually say is that treatment is prevention. Don't even do it in the first place. Don't even do it in the first place. Because depending on the type, you begin to wonder how do people think? You just cut and you suture. You begin to wonder who are the, and it's being done by the senior citizen, the women, the younger ones. You understand? When you ask them what is the effect, and that's what they do. That may be the answer you are going to get. There is no health benefits
at all. Thank you very much for that. Now, another part I would like us to discuss is maternal mortality.
Yes.
So, but before we get to that, VVF that is contracted, or that could be a side effect.
Yes, sequelae to whatever. Yes.
Yes. Is that that could be a long-term complication, right?
Yes. Yeah, you see, VVF, vesicovaginal fistula. You see, God has created our parts to be where they should compartmentalize it. Urine should be here, feces should be here, baby should come out through the middle. Now, if there's anything that now connects to one another, you can imagine the woman is seated and smelling of urine because the urine is leaking into the vagina. So that's the vesicovaginal fistula. Or the woman is just seated and feces that's supposed to get trapped because of the anus. Anus supposed to contract and get the feces to be there. But the feces just seep into the floor of the vagina. You understand? And the woman is smelling of either urine or feces. I mean, it's not a palatable experience. It's very distressing.
Absolutely.
So that is just the sequel of the cutting or the treatment or obstructed labor as a result of that was not relieved earlier enough that made it to lead into VVF of rectovaginal fistula when the rectum is connected with the vagina. So these are just what is likely going to occur. So it's maternal morbidity. Either you are talking about morbidity, you are talking about severe adverse outcome from pregnancy. Severe maternal outcome from pregnancy. So of which you have all this one. It is those that now died that will now call maternal mortality.
Of course. So, looking at it from that point of view now, as you rightly said, that tells me that maternal mortality is an extreme end of this entire spectrum that we're talking about today.
Yes.
But given that it's that extreme end, say it's like point A to point Z, literally.
Yes.
So how does FGM contribute? How does FGM flow from that point A to that point Z, where maternal mortality is now an effect of female genital mutilation? How does female genital mutilation contribute to maternal mortality?
Yes, you see, when we're talking about maternal mortality, we are only talking about what are the causes of death.
Yes.
Related to pregnancy, or its management or its outcome. Of course, we have hemorrhage, which is bleeding. We have bleeding as being the commonest cause, of why will a woman die in pregnancy or during childbirth or after. Or other ones are just hypertensive disorder. We have infection, we have all this complication of an abortion. So the bleeding aspect, the only way in which FGM contributes to maternal mortality is on the aspect of excessive bleeding that might occur following delivery, because the vaginal capacity is compromised, it cannot distend very well, and if you finally distend, it might tear, and there may be what we call severe laceration. There's what we call 4th degree vaginal laceration. We have 1st, 2nd, 3rd, and 4th. There is any of this one is associated with excessive bleeding, and as I've said, it's not this woman might not deliver, in a place where they have blood, where they have competent hands or skilled people who can quickly and arrest the bleeding or get blood from blood service center. The person will just die from bleeding, not from FGM, but because of what FGM causes. FGM leads to what we call severe laceration of the vagina into the rectum, and possibly into the rectum, and cause this bleeding. So that's just the only connection which they have.
But that's a very valid connection. That's a very serious. That's a severe connection.
It's severe, yeah.
Because, like it or not, if it wasn't done in the first place.
Yes.
That will not be
occur.
exactly. That will not be happening due to that laceration. That would not even occur at all.
Yeah, apart from medical disease, especially HIV. Of course, in these days, HIV is being well controlled by the use of their drugs anyway.
Yes.
Apart from medical condition, or it's on the extreme that the maternal and the postpartum blues. I mean, postpartum depression, especially postpartum psychosis. That's one that is so very, in which the woman might even think of killing herself or killing the baby or killing anybody around. Of course, it's very little fraction that FGM will lead to such psychosis.
All right. Thank you. So we're rounding off very soon.
Yes.
But given all of this that we've discussed so far, do you think that what do you think the role of the government is in reducing these effects of female genital mutilation and their effects of on maternal health?
Okay. The role of the government, the first thing is just that it's not enough to just say you are banning particular harmful traditional practice. It's not enough. There should be community-led approach to eradication this. And when I talk about government, it's not federal. Even the local governments. So from federal to state to local government, it has to trickle down in such a way that they have to make the community to participate in this eradication. Because when you just stay in one place on the federal level and bringing out prohibition law or prohibition acts, of course people will do it secretly. You see, it's not when someone report that that one Baba has done it. People that want to do, they will do it. You understand? So it's all about community participation, community-led approach, letting them to see the health risk. Those are what we are talking about now. Health risk of FGM. Let them see that, these people that are doing it, because let me tell you one thing, the reason why it will be difficult to eliminate, because it's giving some people economic benefits. What do you want the Baba or the mama, the circumcisers? What do you want them to be eating? When you collect the scalpel from them, I think when you collect the scalpel from them, give them another thing. Let them be change agents also. So it's not enough to just make law. Of course, making law also is also very important, because when someone knows that something is against the law, they will not do it. And when they know that they are doing it in a discreet manner, they know that they are committing crime. So making law is good, to ban it, and there should be public statements coming out to make a public statement by the religious organization and by people in the community, the people that is well respected, like the traditional ruler in the community. They should also come out to make public statement as regards this one. So all these are what the government can do from federal to the local government.
Absolutely. And then let's now talk about the international bodies.
Yeah.
In the course of your speech earlier, when you were talking and answering some of the questions, you mentioned WHO, that they've clearly stated that no medical doctor should be involved in medicalization of female genital mutilation. So given that is a declaration, that's a rule, that's a law, basically, from the WHO, what are some other measures that they've put in place to reduce the popularity or the frequency or to completely eliminate female genital mutilation so far?
Yes, what they have done, it's not only World Health Organization, UNICEF, all those international bodies as with respect to the rights of women.
Yes.
They also came out to also denounce it and to also speak against it. And so what the international bodies have done, they are not too far-fetched from what I just mentioned. What is done on in our local domain here. What they have done is just to make sure that the community are well educated, well enlightened, program are supported to talk about the negative impact that this FGM is having on the community, and to let them know that look, whatever cultural benefit you think you are having from this, now the health dangers coming from this outweigh some of these baseless reason why it is being done. So the international body are just to do some programs and to also enable the community and to support maybe the federal to making sure that they are able to take this thing to the grassroots and not to stay on the international level like that. Go to the community by using their own agents to make conversion of the circumciser to people that will also be the one that will not be doing it, not only not doing it, but telling people that it is not good. But if you don't give them what to eat, I think they'll be doing it, indirectly, just to get to get money. So what the international body needs to do is it's not far-fetched from what I've just said about the federal level. Join all programs like this program now. They can have many of such programs, in another forum, in another state, to making sure that this goes to the grassroots and people understand that FGM, female genital mutilation cutting, has no health benefits.
Absolutely.
And it's disastrous to anybody's physical, mental, and social well-being, especially the women.
Thank you very much, Dr. Odofin James Taye, consultant obstetrician and gynecologist, Federal Medical Center, Ebutimeta. This has been a very enlightening conversation, so thank you again for joining us on Let's Talk FGM. Thank you for joining us. Thank you to you for listening, and this is what we call it a day on Let's Talk FGM today. Wednesdays, 2 p.m. is the time on Women Radio 91.7 as we discuss FGM and condemn the practice. Let us join hands to stop FGM and to report cases. If you want to report cases, if you see of any of these cases around you, please call 0812 467 0069. I'll take that again, 0812 467 0069. Get more information on stopcut.hacy.org. Get more information on stopcut.hacy.org. Thank you again to you for tuning in. Thank you again, Dr. Odofin.
Thank you so much for having me.
Thank you to the producer, Adenike Kodri. My name is Sumto Titilayo Ajama. Good afternoon.
Àṣàkẹ́ Yéṣu kú lè rọ́pẹ́ ṣe bí ìyá àgbà onígi ló fẹ́ dábẹ́ fún wọn.
Èmi ò fẹ́ dábẹ́ fún ọmọ mi. Àwọn àdúgbò ẹgbà wọ́n fẹ́ dábẹ́ fún ọmọ ẹgbà wọ́n. Àwọn ọmọ fẹ́yìn ló fẹ́ dábẹ́ fún Àṣàkẹ́. Ìyá àgbà onígi gan ni wọ́n sì pè pé kó wá dábẹ́ fún.
Ṣé bí ìjọba ti ní ohun tó léwu ni? Èwo sí ní láti máa dábẹ́ fún ọmọbìnrin.
Ṣé bí nǹkan tí wọ́n fi yín bàbá bọ́lá lọ sí ẹ̀wọ̀n ọdún mẹ́rin nígbà ọ̀nà? Ẹ̀wọ̀n ìmọ̀ràn tẹ́wọ́ nínú gbogbo tí lábẹ́ tẹ̀fẹ́ àwọn olè. Ìtọ́wọ́pàá sí mi.
Àti ẹ ti fẹ́ kọ́ máa yín kú. Àwọn ọmọ pọ́n tó léwu ni. Àwọn òwúrọ̀ ọ̀làjú ló fẹ́ ba àṣà àti ìṣe wa jẹ́. Ó yá ẹja lọ lé àdábẹ́mọ́ ìyá àgbà onígi ń kọ́.
Iṣẹ́ tètè lọ tẹ̀ mọ́ wọn létí náà kan sí pé dídá abẹ́ fún ọmọbìnrin tó tí ò dá ni kí wọ́n lè pàtí níbẹ̀ kọ́ á padà fẹ́ jẹ́ wọn